The evaluation plan um, is focused on identifying if organizational support and job satisfaction of psychiatric mental health nurses in an inpatient facility improves the quality of care being provided to our mental health patients. The questions that we would want to know if our program has been effective is if the inputs are sufficient to the overall program, if the recognition and knowledge increases the employee satisfaction, if it increases the employee job satisfaction and improves the quality of patient services, if knowledge and curriculum of employee support services delivered are efficient and timely, and if in the improvements in the work environment improve the quality of services. Indicators of evidence is that we would see an increase in nursing staff attendance for the program. We'd see an achievement in professional development, such as ANCC certifications. We'd hopefully see equality in nursing skills. We'd have a decrease in nursing burnouts and call-offs. We'd see more supportive and collaborative working environments. We'd have an increased report of quality care from patients, an improvement in patient surveys, less clinical incidents in inpatient facilities. We'd have an increase in curriculum trainings being held for our nurses. We'd have more certifications completed. We'd have positive feedback on curriculums and professional support. We'd have a decrease in nursing call-offs. We'd have an increase in patient satisfaction and the quality in care. Collection of the data would be quarterly for job satisfaction and work environment data. The data would be collected during multiple times when implementation plans have been completed. We'll reevaluate to see if the work environment has improved and if we've seen any indications that our plans aren't working, then we'll make changes and then we'll reevaluate it again. We'll also do daily collections of patient surveys during discharge to assess the quality of services during their treatment period. And we'll also do monthly or yearly nursing surveys so that we can assess the emotional stress factors of our nurses. Our sources for the information is going to be provided to our leadership members, such as managers and supervisors, as well as the nursing department. We'll use existing databases, agency records, research reports, nursing surveys and patient surveys, and then our sample, of course, would be our nurses and our patients. The tools that we'll use are patient satisfactory surveys, which will be either mailed, used electronically, or through telephone or on-site assessments. We'll also use a practice environment scale of nursing work index. This is to identify the work environment and whether they feel that the work environment if our nurses feel that the work environment is healthy or not, or if there are things that require leadership's attention for improvement. We'll also use an inventory tool called the Maslach Burnout Inventory, which is also labeled as the MBI Human Services Survey. They use that name to avoid sensitization of burnouts, and this is a tool that measures emotional exhaustion of our staff, and it's a 10 to 15 minute self-administrative fill-out scale. And then we'll use the nursing care and patient safety surveys to assess the employment status, their setting, their role, their work environment, the experiences of burnout, and then their job satisfaction. And then we could use the National Inventory of Mental Health Quality Measures, which is an searchable database for quality assessment and improvement for mental health. And this measures have been actually developed by government agencies and researchers and professional organizations who have found methods of providing services effectively. And then finally, we can use HCAHPS, which is a database that assesses patient satisfactions and standardized care at a national level.